Cancer has stolen many lives, and many only discover that they have the disease when it's actually too late.
Today is World Cancer Day, and the health department will be raising awareness. But activists say that's not enough. They say treatment is expensive and not accessible to everyone. They are calling on government to close that gap. Let's discuss this further now with Joanie Sadie from the Cancer Association of South Africa. Very good morning to you, Joanie. Thank you so much for joining us. This is something that we've been dealing with for the longest time now. I mean, I'm talking since the dawn of time we've been dealing with the issue of cancer. And just in the last 20 to 23 years, we are seeing numbers of 45% increase in just the number of deaths in this country. That is essentially about 500,000 people each year. That is a scary statistic. And I mean, it's not discriminatory, this disease. It's taking, you know, the people who are the poorest of the poor. It's taking people who actually do have access to really good quality medical assistance. So how then does the government go about closing that gap if this disease is just taking everybody?
Marina, I think the sad thing about the fact that you just mentioned is that thousands of these deaths are preventable. If people have access to education and if they get their screenings and if they know their rights, then many of these deaths could have been prevented. And that is why Cancer and the Union for International Cancer Control has taken hands, and we're advocating to government and to every individual to find ways in which they can close the care gap. You know, it's very important that we go into those rural and hard-to-reach areas that are underserved, and we bring services and education to people there, make them aware of their rights. And every person can take responsibility for their own health as well. And in this way, we are all taking responsibility, taking hands with government and finding ways to close the care gap. Because this year, the message of International Cancer Day is, what are you doing to play your part in imagining a future without cancer or a cancer-free future? And we absolutely can do that, and we absolutely can get there. But that would mean that every one of us will have to play our part. We have to go for regular screenings. We have to look at a healthy, balanced lifestyle. You know, quit smoking and vaping, avoid more alcoholic drinks, and just take general good care of ourselves.
Yeah, you know, Joanie, as you're speaking about that, and I want to labor on the point of access, because a lot of times when we're speaking about cancer and the preventable elements of it, it requires good quality healthcare. Our healthcare system is already hanging on by a thread, a thin thread, mind you. And yet, I can imagine how the most vulnerable, especially those that are sitting in the rural communities, how long does time actually lag before they actually get somebody to properly diagnose? The proper diagnosis of the type of cancer requires one. That's when somebody's going to get good quality access to healthcare. But we're not seeing that. So then, in terms of just what we're observing from a national kind of periphery, how dire is the situation, especially in those vulnerable areas?
You know, Faith, it's unfortunately true that cancer kills more people than AIDS and TB combined, yet we don't get the same resources to fight this disease. However, we are taking hands with corporates in South Africa, and we are putting mobile units out into these communities and really trying to strengthen government's hands. And I do think that it's become a very important point on the government's agenda. So through advocacy and lobbying, we have been able to get a bigger budget allocated towards cancer, the pandemic. And again, I just have to say that it's organizations like Cancer that make available free resources, thanks to the partnerships with government and with corporates. We can close that care gap. Unfortunately, it is happening slowly, but we are getting to a point where now it's really on the agenda and it's getting the attention that it deserves.
Joanie, now I put forward to you a scenario where someone is saying that I do look after myself, you know, healthy eating, I don't drink alcohol, I do not smoke, I do go for regular tests and screenings. You know, I'm talking about someone who's a health freak, so such a health freak that, you know, for them they check for everything, and yet they still suffer from it. And then what then do you say to them who says, I do all of these things and yet here I am?
Marina, it does happen, and we always say early diagnosis is key, and then you have a better chance of treatment and beating cancer. And we also say that now that you do have this disease, there is resources available to you. You can call the cancer toll-free number, and we can help you with psychosocial support, physical and other support. You are not going through this alone. It's not the end of the journey, it's just part of your journey, and you can get back to good health.
Yeah. Very quickly before we let you go, then how do we then speak to somebody who actually is afraid? You know, from what we've been reading and understanding, and not to pick on men, but men are usually afraid of going to hospitals, going to the doctor. You see, he's nodding profusely, going to the doctor, going to check themselves out. And so the disease then just festers, it spreads, not because of access, but also because I'm too afraid to find out what is wrong with me. Women go to the doctor, men struggle going to the doctor, and yet we've got the prevalence of prostate cancer and testicular cancer that we have to contend with. How then do we start even having those kinds of difficult conversations with our male counterparts to say, hey guys, go to the doctor, hey?
Well, Faith, there I have very good news for men, is that you don't have to fear the prostate test anymore, because now we can do a full blood antigen. So it's just pulling a vial of blood and doing a test, sending it to the lab and getting the test back. But this is why corporate partnerships are so important. For instance, the Hollard Daredevil Run, where we bring the message to men in a fun way, put on the purple Speedo, and now it's just the bros chatting to each other, saying, hey man, don't be afraid. And then even the funds raised from that run is then plowed back into the community, with the Hollard Man Band taking screenings and education into those underserved areas, and also helping those men and women understand that the test isn't so scary anymore, where things are changing with leaps and bounds, but we have to take care of ourselves. And then, so it's changing a very scary message into a message of hope, and not, this isn't something that's beating me, this is something that I can beat. I just need to take care of myself.
Yeah, most definitely. We really do need to take care of ourselves, because also the age, the just cancer prevalence is no longer, just wait until you're 40 to start checking yourself. At 32, I need to start checking myself, because anything could really be possible. But thank you so much, Joanie. We're going to leave it there with you for this morning. That is, of course, Joanie Sadie from Cancer, just talking to us, of course, on World Cancer Day. The